get together, because that's what this election is all about. It is about all of us getting together and being stronger for it. So come on, you guys, move on up. Good. So this really is a historic moment, like Mike says, in so many ways. It's historic for the party, it's historic for our communities, for the nation, for the planet. We have really an awesome responsibility, I think, because there's so much at stake. Virtually everything is at stake. There's really nothing that's not at stake at the moment, between people, peace, the planet, democracy, civil liberties, our healthcare system, our economy, our jobs, our climate, you name it. It's really very much all hanging in the balance. But equally, we have this mind-boggling opportunity, because it is such a wake-up moment right now. And people are not only waking up, they are standing up. And we just happen to be in the position as the Green Party of having sort of been at the cutting edge for a couple of decades. So we're just incredibly well positioned right now to be the vehicle for this transformation that is begging to happen. Exactly, yes. So I want to just give a big thanks to all of you, because I know there are many people in this room and many people in the Connecticut Green Party who have been there building from the ground up for decades. So big thank you to you all for having made this moment possible. We've basically been ahead of the curve for decades, and suddenly that curve has caught up to us with a vengeance on the green economy, on taking care of the climate and our environment, on a just and relocalized economy that actually creates a living, breathing, human-scale economy at the level of our communities, sustainable and organic agriculture, clean, renewable energy, a Medicare for all single-payer system, marriage equality, a Green New Deal that will create the jobs we need on an emergency basis, not only to put 25 million people back to work, but also to transform the economy. We don't need to recover to the same old Wall Street phony economy of the 20th century. We need a recovery that moves us forward into the sustainable, just, relocalized, clean energy economy for the 21st century. So when we create that economy through the Green New Deal, we're also creating a few fringe benefits. Like, for example, we make wars for oil obsolete. How about that one? We put an end to the climate crisis because we're moving to green energy. We put an end to unemployment because we can do it, we know how, we can create these jobs instead of creating a stimulus package, which is mostly giveaways and bailouts and tax breaks for big corporations. We can create a stimulus package, which is exactly the jobs that we need. We can directly fund job creation through our communities, and that's what the Green New Deal will do. We can, in addition to, well, let me speak to it directly, we can create health care as a human right through a Medicare. We don't need no friggin' mandate.
That's right. That's right.
Even if the Supreme Court chief calls it constitutional, well, it may be constitutional, but it still basically sucks.
Yes, right.
And it doesn't work, and I can say that in Massachusetts, where the best thing about healthcare reform was, guess what? It was Medicaid expansion, which actually had nothing to do with healthcare reform. That's what really brought so many people into healthcare coverage in Massachusetts. The failing part of the system is actually the mandate and the so-called Obamacare or Romney Care in Massachusetts. It really did not fix the problem. It didn't control costs. It is still bankrupting people who need health care, bankrupting our communities and bankrupting our state, to where health care has now grown so that it's about 50% of our budget. Everything else has shrunk in order to make room for this just growing morass of private health insurance waste, effectively. So we can fix that with a Medicare for all system that covers everyone comprehensively, that provides health care as a human right, and which actually puts you back in charge, puts you back in the driver's seat of your health care decisions, not some CEO who's looking to squeeze you for maximum profit. So it puts you in charge, and the well-kept secret is that it actually saves us trillions of dollars over the coming decade by eliminating the wasteful health insurance bureaucracy, which is gobbling up 30% of every healthcare dollar. That can be squeezed down to 2 to 3%. That's what Medicaid does, Medicare does. And through a Medicare for all system, we can capture that efficiency. We also do away with healthcare inflation. And it's that which will actually save us trillions of dollars over the coming decade. Well, yes, to preventive medicine. In fact, how about instead of a sick care system, we actually have a health care system?
Right.
And this is one of those fringe benefits of the green economy. Because the green economy means what? It means pollution prevention. You don't have pollution because you've basically done away with fossil fuels and all their derivatives, which are most of the pollutants that we're dealing with. But it also means that we have a fresh, local, organic, largely plant-based food system. And it means we have a healthy transportation system consisting of walking, biking, and public transportation. And isn't that what your mother always told you? That if you want to be healthy, you know, it's not so, you don't need an MD from Harvard to know what it takes to be healthy. It means eating right, getting exercise, and avoiding poison, which is unfortunately part of the air we breathe and the food we eat and the consumer products we use, and increasingly the water that we drink. So by doing the right thing up front in the Green New Deal, we basically create that green economy, which is the infrastructure for health. And a well-kept secret is that 75% of our healthcare costs are spent treating chronic diseases which are preventable at a tiny fraction of the cost. So how do we prevent them? Basically through that Green New Deal that creates healthy food, healthy transportation, and green energy. That is the infrastructure for health that we're waiting for. We're spending over $2 trillion a year on our healthcare system, but remember, 75% of that can be avoided by doing the right thing up front. So we stand to benefit, you know, potentially $1 trillion a year by doing the right thing. And actually there's a well-documented case study of what happened in Cuba when their oil pipeline went down. This is a study done actually by Johns Hopkins, so this wasn't Cuba's own public relations campaign. This was a study published in the journal Epidemiology, a professional study that actually found when they had to convert to the green economy, their death rate from diabetes decreased 50%, their obesity rates went down 50%, and their death rates from heart disease about 30%, and from strokes 20%, and all-cause mortality went down. And how much did they spend on it? $0. They had an absolute healthcare revolution, spending nothing. We spend $2 trillion a year and we can't even come close. So it just makes the point that you were alluding to, that we can do so much to create a healthcare system and not rely just on this very expensive, failing disease care system that we have. So there are win-win solutions. I'm going to mention just two more quickly. It's time to bail out the students. We bailed out the banks. We can bail out the students. They didn't cause this problem. The banks did, yet we found a way to bail them out. For far less, we can bail out the students and free them up to be the real engine for the economic recovery and for the imagination of the economy in the 21st century, which we rely on them to do. While we're at it, we can make public higher education tuition free. It should be. It's long overdue. It's an investment that pays back 7 times over. For every dollar invested, we get 7 in return. We know this from the GI Bill, where we actually gained money, lots of money, by putting over 1 million soldiers through college for free. We can do the same thing now. And finally, it's time to put an end to this racist and terribly misguided war on drugs, so-called, which is really a war on people, on poor people and people of color. Marijuana, as you may know, is a drug which is dangerous because it's illegal. It's not illegal because it's dangerous. So on day one, a president, if she wanted to, could actually instruct the Drug Enforcement Agency to actually use science. Imagine that, to use science in determining the scheduling of various substances. Because if science was used, then certainly marijuana and hemp would be taken off the list of scheduled substances on day one. It doesn't even require a congressional vote. This could be done through the DEA. So all kinds of solutions out there. And what's especially exciting is that this is what people are begging for. In poll after poll, these are the solutions that people are standing up and calling for by large majorities right now. So we don't actually have to convince anybody. We just have to stand up and drive these solutions into the public debate. The powers that be, of course, want us to be quiet, and they are working very hard to make us quiet. They have this thing called the politics of fear. I think we're all familiar with that. It has rained down on us for at least a decade, since the time of Nader, and even long before that. We've been told that you don't dare stand up for what you want or for what's right. You gotta just hold your nose and go with the lesser evil, and that will be fine. But we now have 10 years of experience to show that silence is not an effective political strategy. And in fact, the politics of fear has actually delivered everything we were afraid of, and delivered it in spades. So in this campaign and in this election, we are standing up to the politics of fear and telling it goodbye, because here comes the politics of courage. That is what we are about. That's what this campaign is about. That is what the Green Party has always been about.